Welcome to Dr. Gore Show. Today's topic is admit in the hospital. Now what? Those are the scary words to hear with any one of our loved ones. When that happens, what do we expect? To talk about this important topic, we have Dr. Moise Kasubai with us. Welcome to Dr. Gore Show.
Good evening, Dr. Gore. Thank you very much for inviting me today.
So Dr. Moise Kasubai started his medical school in India, and he did his training in internal medicine in Bombay, and then he went on to London to get his degree of MRCP and came to United States and did his education in New York in internal medicine, and now he specializes as a hospitalist, and he's a chief hospitalist and vice chair of Department of Medicine in New York City Hospital in Bronx, and he's also a clinical assistant professor at Weill Cornell. So you have a lot of accomplishment, and in the United States you have specialized as a hospitalist, which is not very well known branch of medicine that a lot of patients are aware of. But as the name says, hospitalist, you deal with patients when they are admitted in the hospital.
So that's right. So we are internists by training, but we take care of patients who are admitted in the hospital. So we specialize of their care where they're in the hospital. That increases the get better outcome. Mm-hmm. The patients go home earlier. They're more satisfied with the care. We obviously know more about inpatient care and what sort of treatment to give, who to call a specialist, and we are available all the time, 24/7. So that actually improves the patient care overall.
Correct. So this is a branch of medicine, as you explained, where you take care of only inpatient patients, right?
That's
when
right.
they are admitted in the hospital. And that gives you that kind of a niche, because all you do is take care of patient inside the hospital. That way you have their nose and in and outs and all the information during their hospital stay, and you are available to intervene during that stay compared to somebody who is outside. And I think the good thing is not only the patients and the relatives like that, but also the insurance company love you guys, correct? Tell me why.
Well, one thing is, as I was explaining, because we are always available. So in case the patient has getting more sicker, we are able to take care of the patient much faster. They stay in the hospital for a shorter time also. And since we know about all the inpatient care very well, we can give them the appropriate management while they're in the hospital, also make sure that when they go home, they get the appropriate management when they're going home, so that transition of care also is very good. We obviously also communicate with the primary care physician and the specialist. So we are sort of a point where everybody talks to us. It's a bridge where everybody talks to us, and we can communicate with the patient with our specialized knowledge for inpatient care. And we've seen it over and over again. Overall, the care is much better. They stay in the hospital for a shorter time, and they're actually very satisfied with the care out here.
Correct. So your patient care outcomes are much better because the way you guys are specialized in that.
Right.
But the insurance company also likes you guys.
Yes.
Because you have a shorter stay. So
Right.
it's a win-win.
Right.
Because you are saving healthcare dollars, because mm-hmm. you're doing the right appropriate investigations, mm-hmm. and you are there to intervene and either discharge patients home when it's done, or escalate the care up to ICU, a specialized person.
Right.
And that way you're optimizing the healthcare dollars. So I think that's a very important point about knowing about this kind of specialist that is available. So, most of us get admitted as OBGYN. That I know, we admit patients directly either from my office, mm-hmm. or when we do a major surgery, if it is open, because nowadays, we do very minimally invasive, so they are mainly outpatient. Even hysterectomies are outpatients. But when we do major surgery, we get admitted. So I know one way to get admitted to the hospital is
Right.
through physician's office. Now, can you go through those points when you or your loved one can get admitted in the hospital?
All right, so let's start from home, right? You are now suddenly very short of breath, you cannot breathe on your own, you have pain in the chest, or you're developing stroke-like symptoms, you're developing weakness, you cannot speak very well. Or for instance, you fall down the steps and are very sick, unconscious. At this point, you can call the ambulance, call 911, call the ambulance, or the family member can call the ambulance, and they can come and pick you up. Now, the good thing of calling the ambulance, that the EMS personnel that come out there, they actually initiate care at home and during the ambulance drive or ride to the hospital. So they can actually save lives.
Correct.
So that's
so
one
by
way
calling
of it.
911, you are taking important step to stabilize, to kind of make sure they are stable enough
Right.
to that they reach hospital safely so they can do initial intervention.
Right. So now you come to the emergency department and then the doctor may decide to admit you. The other way of admitting is from the primary care's office. So you go to the primary care, he finds your sugars to be really very high, he feels that you have very poor knowledge of it, and you may be vomiting. You're vomiting, you may be having an infection, maybe you have an infection of the skin called cellulitis, and he may feel at this point that outpatient treatment may not work, and he may say, hey, go to the hospital. This is the hospital I'm sending you to. I know the doctors out there and they'll take great care of you.
Correct.
So that's another way to go to the hospital. Now, when you're in the hospital, the emergency department doctors, physicians who are very specialized will decide that if you need to get admitted or not.
Correct.
Now, you may get admitted, go into an ICU level of care. So there are multiple levels of care where you can get admitted. So if you're very sick, or you cannot breathe, or you're attached to a breathing machine, then you go to the medical intensive care unit. If you have had a heart attack, or you have some abnormal rhythm of heart which can be dangerous, which can stop your heart, you may land up going to the cardiac care unit.
Correct.
Or as I mentioned before, you've fallen down, you have multiple fractures, you're bleeding from multiple places, you're extraordinarily sick, then you may go to the surgical intensive care unit where the trauma surgeons will take great care of you. Now, the other levels of care which are lower than this intensive care are also something called as a telemetry unit, where they will be monitoring round the clock 24/7 your heart rate, your blood pressure, your respiration, your oxygenation, and other things. And they can keep a very close eye on you. So in case you do become very sick, they can intervene and if necessary, escalate and transfer, as you mentioned, to the intensive care unit.
Correct. So these are the telemetry and,
Yes.
and ICU, either medical ICU or cardiac ICU or surgical ICU. These are very, very high level of
Right.
care that in any hospital is given. So to summarize so far, either you are landing in the emergency room or in the hospital like a direct admission, either through your doctor's office, be it a primary care or a gynecologist or even a specialist.
Right.
Like if you have a lung infection, you are getting treated as an outpatient, but if it escalates to a next level that you might need IV antibiotics or you can't breathe, they need to intubate, the pulmonologist might even send you. Or you have an infection, as mentioned, as somebody with a diabetes, infection can spread very quickly and the sugars can go out of control, then you need to be admitted. Or you got admitted for an outpatient or an inpatient surgery, so after the surgery you go to the admission. Now ICU, telemetry, and then the lower levels are observation and inpatient
Well,
beds.
there's also the medical and surgical floors. For instance, you've had a pneumonia, but you're not very sick, you may go to the medical floor. If you've had a fracture, or like a hip fracture, but otherwise your blood pressure is okay, your breathing is okay, you may go to the surgical floor. So those
Sure.
are the lower levels. Now, what is happening now also, we have something called as the observation unit, which is usually run by the emergency doctors or by the hospitalists, where you may stay there for around 24 to 48 hours, around 1 or 2 days. Now, those patients are, let's say, for instance, somebody who's had chest pain.
Right.
And the ED physician does not feel this pain is really from the heart, but wants to rule it out. And rule out that's not from the heart, and he wants to run some tests, like a stress test. He may keep the person in an observation unit. Or let's say you're having diarrhea for the last few days, and you're a little dehydrated, your fluid is less in the body, they admit you to the observation unit, give you fluids, and within 12, 14, or maybe a day, you're better, and they'll send you home after that. So those are the observation units.
Correct. And now there has been a difference in the definition of observation, just for our viewers. Before Medicare and Medicaid, which most people admitted in your drainage area have
Right.
that insurance compared to a private insurance, the definition of observation used to be less than 24 hours, Now they've changed it to less than 48 hours. If you're admitted and you leave within 48 hours or less, it's still called observation.
That's right, yes.
So that's something that you should know, because you might be staying 2 days in the hospital. In
Right.
your mind, you were admitted for 2 days, but they might still consider as an observation
Absolutely.
unit. So that's kind of more like a technical definition. So now, in whatever way you've been admitted, it's still a scary kind of situation to be there. And not only you are dealing with your pain or whatever emergency that showed up, but the loved ones or the people around you, or if you have an elective admission, what they should come prepared with, because that's
Right.
usually the question people ask: what do I take with me to the hospital admission?
So it's extraordinarily important. One thing, you come with some ID cards, like a driver's license. Make sure your insurance card is with you. I must tell you, your cell phone with your charger should be with you, because there's a whole lot of information that you stored out there, like the primary care physician's number, his address, the specialist that you've seen. You may also have your medical records accessible out there. So getting your cell phone along with a charger is extraordinarily important out there too. But don't forget to get your medication. Now, if you don't have your medication list, get all the bottles with you, because the physician needs to know what you're taking. The pharmacy may tell that you are on these many medications, but what you're actually taking may be quite different. You also make sure that you get the over-the-counter medications you're taking, like Motrin, Aleve, or any herbal medications you're taking, because these may actually affect the care of the patient and maybe the cause of the problem. So I think all of this stuff is extraordinarily important. Another thing, don't forget that if you do have electronic access, or you have a flash drive which has all your medical information, or you have some sort of codes or passwords that you need to know, get them along also, so the physician can access all your records really right away.
Or any paper charts or any investigations
Yes.
that you have access to. Please bring as much information to give it to the doctors who are taking care of, because it's not only your primary care or your specialist, because say you're going for surgery, your anesthesiologist might need to know. So it's always better to bring as much information that you have handy when you get admitted. And apart from the other practical stuff, as you mentioned, like chargers, and phone is like life for a lot of people now.
Right.
So bring those things, laptops, if you want to be, like especially post-op time, when you're there, you can still do your work or some kind of email communications, so make sure you have those. But also other things like your glasses, your lens fluids, like slippers, your personal things that you might want to carry with you, your special shampoos or whatever, because that's very important. So you've done the process, now you're in the hospital. Most people, and especially our South Asian population, is very scared to ask questions.
Right.
But as you insist that the patient have a lot of rights, and they need to know what rights they can, kind of
Right.
make sure you're not offending the physician, but something that you should know. So what are the questions that they should ask the physician that will help them understand why they are there and what to expect?
So you're absolutely right. Right now, most patients play a very passive role. And we really want to encourage you to play a very active role in the management of your patient. So you should be asking simple questions. First thing, why are you admitting me? What I have, can I manage this at home? I can do this to manage at home. Well, maybe the physician says, no, you cannot manage this at home, you need to get admitted. So that's one question you should ask. Also ask, what is the diagnosis? Now, quite often we know it, sometimes we do not know it, and that may be the reason we are admitting for you. For instance, you may be having a very high fever and we don't know where the infection is coming from and you want to admit you, but you should ask what your diagnosis is. You should also ask, what is how long will I stay in the hospital?
Most likely what?
Yeah, most likely be one day, 2 days, 3 days. So I can plan, I can tell my family, my loved ones, this is how long I'm going to stay. The treatment that you'll receive. How often you'll be drawing blood tests? What are you going to do? Any radiological investigations like X-rays or CAT scans and MRIs, or any invasive procedures? If I come with chest pain, are you going to do a cardiac catheterization, where they actually put a catheter through the groin into the heart and see if there are any blockages in the vessels of the heart? So if you actually actively take care of, ask these questions and actively take part in the management of your own self, the doctor, the healthcare team is more likely to be more responsive. They're more likely to give you better care, and your experience will improve, and so will the physicians. They actually appreciate their healthcare team actually appreciates when you're asking these questions, because they can clarify, and that will help them also to understand more about what you really want, what expectations are really. Also ask them what are the alternatives. I mean, if they say this is what you need to do, this is what surgery you need to do, this is what procedure you need to do, are there any alternatives? And why are we not using the alternatives? And if you really need a second opinion, please ask for a second opinion also. Don't feel shame or guilt about it. This is your right, this is your health. You should be very proactive in taking care of your own health while you're in the hospital.
So we always encourage patients to play an active role and know your rights. So do not hesitate without insulting. I think you have a right as an admitted patient, or even if your loved ones are admitted, what is our diagnosis? Why are you getting admitted? What are the expected kind of length of stay? Yes, things can change, individualized, but in general, people can give you some idea and update. And a lot of times, I think what has happened in today's world, that the loved ones get admitted, the siblings or the children or the parents are working, and you can find out from physician who's going to be my contact person that I can reach out to get a daily update. Make sure you give your information to the physician, that if there's a change in the condition of your loved ones, they can reach out to you, and vice versa. If you want to find out the care, I think find out the number of contact. And that brings us to this healthcare team, because I think for most patients, I think there are only two categories: either there are physicians or there are nurses. And now healthcare in this country and overall has evolved, and there are multiple levels of mid-level people, as we call it, from nurse practitioners to medical student to resident. So just what's usually your team as you come, case management and all that.
Well, it's no more a physician-driven healthcare. It is a team that works together. Now, the team consists of either your own primary care will take care of you, or it will be a hospitalist, as we explained before. Now, if it's a community hospital, then you may be having a physician assistant called a PA or a nurse practitioner who will work along with the hospitalist to take care of your needs. But it's an academic center where you'll have residents who will be available 24/7 around the clock to take care of you. Now that is the physician or the healthcare part of it. The other part is the very important part is the nurses. Now, you may see the physicians once, twice, or maybe 3 times a day, but you're going to see the nurses all the time. You're going to see the nurses aide all the time. They'll be coming to your room to give you medications. Either it'll be intravenously, it'll be orally. They'll be checking your blood pressure. They'll be giving you meals, assisting you in having meals. So the nurses are the real core of the team, and interacting with them and talking to them about what your preferences are also extraordinarily important, really.
Correct. Yeah. So far we've talked about the reasons and why and how you can get admitted, and to know your rights, what to bring, and the team. So we're going to expand on that. So we are talking about when the doctor says get admitted to the hospital, what you should know. I think that's very important. So we're going to take a short break and we'll be right back. Welcome to Dr. Gaur Show. So today we are talking about hospital admission and what you need to know. So far, Dr. Kasubai, we've talked about why and how you get admitted and know your rights. But the team, I think, is such a core, because as we just discussed, that not only is the attending physician who's the chair or the leader of that team, right. And then he might have a fellow or a resident, a medical student. These are all medical professionals. And then there are mid-level medical professionals, which can be nurse practitioner, associate nurse practitioners to, midwife for, say, OBGYNs, or we can have, a research fellow who might be thing, or observer, and then you have your nurses, you have your case managers, And then you have the nurse's aides, right, which comes every 4 to 6 to every 1 hour sometimes to check the vitals of the patient. They have an important role about managing the, the blood pressure and reporting to the nurses. So there are different levels of people in the team who might see. And as you rightly said, the nurse is sometimes the core person who is there, and they can report the change in the status of the person to the physician or the resident, and that will be kind of like your guide if you have any basic questions. And if the nurses can't answer, they will escalate to the next level. So know all these people who are in charge, because as the shift changes, now the state requires to, most hospitals have like a board now where they say, I am the nurse now from this time to this time, call me on this number, today's date, and they put a pain scale level and medication.
Right.
So I think there has been more transparencies as far as the inpatient is concerned, and the nurse is changing, so you know who is your person.
Right.
But still people get too scared because the hospital, sometimes you read in newspapers that you come out with resistant infection, which are hospital acquired infections, wrong medication given or wrong. How do you limit those things? Can you put some light onto, as a patient, I'm scared to get admitted?
Well, one thing is, as a patient, when a healthcare provider walks in, make sure that they wash their hands, right? Make sure that you ask them, what was the test, what was done on me, and why were they done on me, what are the results of the test, etc. And also now there are multiple levels of safety. For instance, if you're prescribing a medication, let's say you're prescribing some painkiller, right? Now, when you prescribe it, there will be some hot stops out there. It will tell you cannot prescribe this much amount or this often. Now, this same order will go to the pharmacy, and the pharmacist will have a check again and say again, he'll say, hey, listen, Dr. Kasabaya, this prescription is too high, or this dosage is too high, you need to change
or
it.
Interactions with other medications.
Exactly. They may interact with some medication, etc. Absolutely right. And only when it clears by the pharmacy and then it comes back to the nurse, even sometimes the nurse may stop and say, hey, I don't think this medication is right for this patient. I know you've written it down, maybe this medication for somebody else. So there are multiple hard stops, which actually reduces the amount of medication errors we have right now.
And also, they are supposed to check the IDs before giving the patient. They are supposed to check that this is your name, this is your age, this is your, say, date of birth. If it's a common last names of Patels and Shah, they should double check with date of birth. Make sure that medication or the test is for you, not somebody else. Because a lot of times you go from one unit to the other, or you go from unit to the x-rays, or you go for testing. Every level, people are supposed to check your IDs and make sure the band has your right information.
Right.
So that level of safety you do.
There is, that's another level of safety. And what I'm saying again, when it comes, when the nurse is going to administer to the patient, as a patient, it's your right to ask, what are you giving me and why are you giving it to me? And sometimes, in these rare occasions where everybody has missed it, sometimes the patient can pick up and say, hey, I think this is the wrong medication you're giving. It's not meant for me. Maybe my neighbor needs to have it. Really.
Correct. Like, I don't have diabetes. Why are you giving me insulin?
Exactly.
Things like that.
Right. So, so you have to be very aware. There has to be situational awareness. Now, when you're in a hospital, you're sick, you're frightened, you probably are not so awake and so alert all the time. And that's where your loved one comes in a lot. They are your advocate, okay? Correct. They are there by your bedside to make sure the nurses and the physicians and all working as a team, they're communicating very well with each other. And that's where it comes to visiting hours now. So what's happening around most of the hospitals around the country is that they've opened up. So you can come 24/7 anytime to the hospital, be it morning, evening, late night, and be with your loved ones by the bedside. You may also have the privilege of sleeping around next to the bed, really, so that and I think what happens with this, it improves the care, it makes the patient feel less anxious, less frightened, because they know there's somebody next to them who is keeping an eye and is going to help them if they really need help. And we have seen that the treatment is more effective. They also go home earlier, and it makes the whole family very satisfied with the care at the end. So I think overall, opening this visitation hours 24/7 is very important.
But also sometimes you might have to limit because if you are sick and you don't want a lot of visitors, and so you have an option also that you're not obliged that everybody who wants to visit you in the hospital, you can actually, as a patient, you have a right to tell the nursing staff or other that this time I'm really exhausted, I need my rest, can you limit my, visitors? And so it goes both ways. And, after all this is done and they are getting better, I think the other things is the discharge planning.
Right.
And what are your rights as far as when you get admitted? Because they might ask you for advance directive, healthcare proxy. You want to bring some highlights into that?
So exactly. So it comes to advance directives. It's a sort of an umbrella term where we use for living will. Living will is a written document where you have prescribed that this is what I want to be done on me or what I do not want.
Correct.
So let's say I am very sick, I'm on the breathing machine for one month and I cannot come off the machine and I'm unconscious. My desire will be take the machine off.
But that you should have done it before.
I have done it before. That's a living will.
Correct.
I will say that yes, I need antibiotics if I get infection. I need fluids when I get infection. But hey, don't give me any tube feedings when I get very sick. So that's a living will. What's also is very important to have is a healthcare proxy. That when I'm sick, when I'm not capable of making decisions for me, who will do that? Will it be my spouse? Will it be my brother-in-law? Will it be my sister? Will it be my friend? Now, whoever is a healthcare proxy, the physicians have to acknowledge that and that's the right of the healthcare proxy to make decisions when nobody else can make decisions. So that's a healthcare proxy. And then there is something called as DNR, where is do not resuscitate. Let's say you're very sick. You're actively dying, you're very poor health, and whatever we do, it cannot save you. You may decide at this point that if my heart stops, you're not going to do any chest compressions, you're not going to shock me, you're not going to attach me to a machine, and that's called do not resuscitate order.
Or do not intubate.
Do not intubate also, so do not attach me to a breathing machine too. So these are things you should have in mind. One thing I must say that you should have a healthcare proxy.
As we get older,
yes,
or even now, as soon as middle age or something, try to make those living will, advance directives, where you can specify your desires and your do's and don't depending upon where you come from, your religious backgrounds and things like that. And healthcare proxy, as you said, is very important. So there's no fighting between the, your children and the spouse and stuff. So make it very clear. We're running out of time. So discharge instructions, what is...
So I think discharge planning is the most important. Well, in the hospital, they get very good care. They're all doing very well. They're improving. But now they're going home where it's a different environment. So here where will be the case manager will come around and say, hey, what do you need at home? Do you need something to dress up your wound? Do you need to check your sugars at home? So there will be a nurse coming and checking your medications. They know how you know how you're taking your insulin, etc. for your diabetes. That's one part of it. Again, medications. You'll be given some new medication. You need to ask what are the side effects. You need to know, are there any alternatives? You need to know what the cost is. You need to know my insurance will cover for it. And so, and what do I do with the old medications I have? So again, asking those questions extraordinarily
important. Or if there's a change in the dosage to tell your primary care and kind of update them.
Absolutely. And follow-up appointments. Have you given an appointment to follow with my primary care, or do I need to take the appointment? Do I need to see a specialist after I leave, and why do I need to see the specialist?
Or some of the tests which are done, if the result is not available, how do I follow up on those things?
So I think at this end, the discharge planning process, what we always say in medicine, it starts when you get admitted. Because the whole process of educating you when you leave the hospital, how you're going to manage yourself at home is complex. It's not easy. It needs to involve all the family, all the caregivers and the patient, and it needs a care manager, it needs a social worker, it needs the nursing, the physicians and the primary care, everybody to get involved so that it's a very safe discharge. That's
and
what
it's a smooth transition from hospital to home, making sure your primary care is intact. Thank you so much, because I think, believe it or not, at some point in time, either us or somebody from close family or friends might get admitted in the hospital. It's always a scary, because hospitals always look scary, not only just walking in and whole atmosphere, but where do we go? Why are we going? Along with emotional, are they going to get better? So there are a lot of questions, and if you have some basic idea what to expect, what to ask, what is discharge, why do we get admitted, or you know, when do we go home and what happens then? I think hopefully this will help answer some questions. This show is also on YouTube. Go to www.youtube.com and put Dr. Gore show and you should be able to see this. So till next time, goodbye.